Cardiovascular disease is the general term that is used to describe a disease of the heart or blood vessels. Blood flow to the heart, brain, or body can be reduced because of a blood clot buildup of fatty deposits inside an artery, which is referred to medically as thrombosis, leading to the artery hardening and narrowing. Cardiovascular diseases can be the result of various factors such as unhealthy diet, physical inactivity, tobacco use, and harmful use of alcohol. The poor and bad behaviors that you might adopt throughout your lifestyle will contribute and show up as raised blood pressure, increased blood glucose, high blood lipids, and overweight and obesity. This video will educate you and grant you better understanding of what you should know when a heart attack happens and you are by yourself. Let us start by defining the major symptoms of a weak or poor heart that you need to be aware of. Now keep in mind that many symptoms can correlate with different diseases, so if you need to be sure of your case, you need to consult with your doctor. And if one or more of these symptoms persist, you should be responsible enough to seek medical supervision. The early signs of heart disease are consistent chest pain, shortness of breath, coughing, swelling in the legs and ankles, fatigue, fast or uneven heartbeat, and poor blood supply to extremities. When a heart failure happens, it is caused by the buildup of cholesterol, fat, and other substances within the coronary arteries of the heart, and this buildup will restrict the flow of blood and oxygen to the heart cells. When this buildup is taking place, it usually doesn't happen suddenly. The fatty substances start building up slowly in the arteries, causing the heart to start dying slowly. When we talk about cholesterol and plaque building up in the arteries, you need to understand that this doesn't only happen to fat and obese people. People at any age and from any gender can experience heart attacks. That is why each one of you should be aware of the heart attack symptoms, as you need to quickly understand what is happening with your body and how you should respond and act to save your own life. The number one and most common symptom that everyone feels during a heart attack is chest pain or chest discomfort. Chest pain is the classic sign of a heart attack, yet many people fail to realize they need medical care urgently. This symptom is also about feeling a tightness or something heavy in the chest area, and this numbness will expand into the arms, the back of the neck, in between the shoulders, and you will feel you are exerting much effort to breathe and enter air into your lungs. The second symptom that will accompany this discomfort in your chest and your shortness of breath is cold sweat. The third symptom is nausea. We all do agree that nausea and indigestion never equal a heart attack. But when these symptoms align with chest pain and cold sweats, that should ring a bell, and you should be alarmed that something major is happening to your body. Being tired, experiencing loads of fatigue, and having rapid palpitations are all worrisome indicators, especially if you do belong to a family suffering from cardiovascular history, diabetes, or obesity. It is important that you do understand the history or your family and how genetics can transmit various diseases from a generation into another. The main important thing is to first be knowledgeable about the signs of a heart attack, and in case it happened to you, you would be aware that you need immediate medical assistance. Next, when you suspect a heart attack, you need to immediately call an ambulance or have someone rush you to emergency. If you are not alone, let others help you sit and relax while waiting for medical help to arrive. Loosen all tight clothes, and take your chest pain medicine No for heart condition. Taking aspirin during a heart attack is safe and recommended. While it will not save your life, aspirin is known for helping reduce blood clotting in the arteries. If you are home alone, directly call your neighbor or anyone that can reach out to you in a matter of minutes, and stay calm while you are waiting for help. Even though that might and will be extremely overwhelming, try taking your medicine or aspirin while waiting for the help to arrive. Sometimes, when the dispatcher reaches your home, they will first advise to chew an aspirin, which is normally done within the first 30 minutes of a heart attack and was proven to be extremely effective. The purpose of the aspirin is to get into your bloodstream and prevent the clogging of the arteries, which is blocking the blood supply into your organs. What is not recommended and is considered to be extremely dangerous is you trying to drive yourself into the hospital, because in case you lose conscience or you'll get into a cardiac arrest, you will be risking the life of others, as well in case you pass out while driving your car. You need to understand that in case you are aware that you are having a heart attack, your stress level will be extremely high, and you need to try to relax as much as possible. Your neighbors can rush you to the hospital, and in case you are waiting for help, sit back, take deep breaths, lie on your back, put a pillow under the knees, and keep them 90 degrees, while putting your feet on a chair or a couch. This position will allow more oxygen to get into your body. If you are suspecting having a heart attack, do not try to eat or drink before you get to the hospital, because this will make it much more complicated to the emergency crew once they reach out to, and they need to apply first aid help. I truly wish you good health, and since we are talking about heart attacks today, you need to understand that adopting a healthy lifestyle can extremely lessen the risk of cardiovascular diseases. That is why you are advised to watch your diet, eat more greens and proteins, and less fat. Quit smoking, drink responsible, and adopt a very active lifestyle. Do not forget to get tested regularly to stay aware of your health status, especially if you have a family history of heart disease. I wish you good health, dear friends. Do not forget to like the video and share with your friends to spread awareness. Subscribe to the channel for more content and leave your thought in the comments section below. Have a great and see you in the next episode.